development specialist with Centric Home Health. And we actually have a great show for you today. But before I do that, I'd like to tell you a little bit about Centric Home Health and Hospice. We have 7 offices between Oklahoma and Texas. We provide nurses, aides, PT, OT, social worker, and chaplains for our home health and for our hospice. We have palliative trained nurses on both sides, so that's amazing. We have low patient nurses ratio for hospice. So there's a lot of great things going on with Centric right now. We have an office now in Plano, Texas. We also have offices that are opening up in Shawnee, and we are in Oklahoma. So if you have any of those patients or residents that are out there in the rural areas, we can definitely help you. And now we can help you in DFW. We have great partnerships. And today I would like to talk with you and tell you a little bit about our show. But before I do that, I'm going to thank Home Care to Go platform for this platform and for bringing this live programming and awareness to our community regarding local healthcare businesses, resources, by education experts. You can see us live on Facebook, Instagram, and Periscope, Twitter, and you can follow us on social media and get notified when we go live. So yay! If you are interested in having a conversation with us and spotlight your role in your company's offering, please click under the description below and sign as a speaker or sponsor. We'd love to hear from you, so check us out. So today we have great leaders of our industry. Our topic is we are entering into the fall and how senior care leaders in North Texas are preparing for fall in 2020. To discuss this topic, we have wonderful guests here, which is Mr. Godwin from Teresa's House and Miss Mary Gilliam with Monarch Senior Home Care. I would love to tell you both about these entities, but for first, I'm going to let you see a little bit about what we can show you on our video that we have from Godwin and Teresa's House.
Welcome to Teresa's House, Craig Ranch.
So there's a little bit about Teresa's House, and now I would love to introduce Godwin Dixon and Miss Mary Gilliam from Monarch Senior Home Care. Hi, everybody.
Hey, Michelle, how are you?
Hi, guys. And I know that you guys
Good to see you guys both. Glad to be with you guys.
Yes, and I know that you guys have both been on before, so this is actually not a recap, but this is actually moving forward on what's going on. So, Godwin, if you would like to talk a little bit about Teresa's House and at the grand opening and all of the great things that have been happening, I'm sure everyone would appreciate it.
Sure. So I'm Godwin Dixon, and I'm the co-owner and the co-founder, along with Teresa Whittington, of Teresa's House. Teresa is my business partner. She's an RN BSN and a nationally recognized expert in senior care as well as dementia. For 17 years, as many of you guys know, I was the president and CEO of the Presbyterian system, and I retired at the end of 2016 because Teresa and I had the chance to build what would be a world-class community. And because it was her idea to create an intimate setting like this, we called it Teresa's House. Obviously, you don't put your name on it if you're not pretty darn proud, and we're pretty darn proud of it. Teresa's House is what's known as a best practices assisted living and memory care community, which basically means that it reflects the best practices that we have picked up over 30 years of doing senior care. and not only our own experience, but our nationwide travel and seeing the best of the best. It's a community where no corners were cut. We have made this first class in every way. Now, I told you why it was called Teresa, Teresa's house, but now let me talk about the house part. We named it that because, in a nutshell, we created a cul-de-sac of houses, 3 different houses, each built with 12 to 16 rooms, specifically designed with the latest innovations for senior care. Concept being, everyone would prefer to be at home, but being by yourself at home is not good for you, and nobody's house is built for senior care. And so at Teresa's house, we're large enough that we can have a good group of seniors, but we're small enough that we can really focus on the individual and we can personalize care in a way that others can't and or won't. But a beautiful building is important and experienced leadership is important, but without the right staff, none of that matters. And we have an outstanding staff. We pay them very well. They have high standards. We have high standards. We expect a lot out of each other, and it's really working out beautifully. The team is thrilled, the families are loving it, and the residents are really excelling. As we know right now in this time of coronavirus, a lot of seniors have really been suffering from isolation, and the seniors coming into our high engagement model have just responded beautifully, and it's been really rewarding to see that. Michelle and Mary and I were talking before the podcast started about when you've worked for years to create something and then you see the seniors really benefit, how rewarding that is. And that's what we're getting to see. So Teresa's house is in Craig Ranch, McKinney. Craig Ranch is where Allen, McKinney, Plano, and Frisco come together. And we officially opened our doors a week ago, this past Monday on July 27th for memory care. And we open our assisted living on Monday the 17th. So we're excited and we're open.
Amazing. Thank you so much, Godwin. We sure have a lot to talk about, but with that being said, I would definitely love to give Mary Gilliam a chance from Monarch Senior Home Care. So Mary, I would love for you to introduce yourself and let everybody know who you are and what you guys stand for.
Absolutely. My name is Mary Gilliam with Monarch Senior Home Care, and we were built with a foundation of experience and passion, and it merged together to come together with Monarch Senior Home Care. We are a non-medical in-home care provider. We really value the clinical component. So we have nursing supervision. We can do RN delegation. We can do live-ins, especially now during COVID. We can do just a lot of various things depending on the need. We recently brought on a medical director to help support the clinical component, especially during a pandemic. And we really value training and education so much, in fact, that we started a nurse aid training program, Monarch Care Source, that's licensed both by Texas Health and Human Services and the Texas Workforce Commission, so that we could also open it up to the public.
That's amazing. So thank you, Mary. That's awesome. You guys are really, we have a great relationship with Centric and you guys. We're in a lot of the same buildings. So thank you so much for everything that you guys have done for us. And I hope if there's anything that we can do for you, I would love to be a part of that because you're my favorite. Oh, not allowed to say that. Just kidding. I'm just kidding. I know, but I do love you guys. And I think that you guys have a great, entire entity of what healthcare is and should be. So I thank you for that. I'm going to bring Godwin back on so you guys both can answer some questions. There's a lot of exciting things that are happening. And one of them is with Texas relaxed on their visitation policies as of yesterday. Would you both elaborate on how you are implementing them and what to watch out from your business point of view? And I'd love to hear what both of you have to answer.
Sure. Mary, do you want to go first or you want
No,
me to
I'll
go
let you first.
All right. So obviously there had been a lot of pressure on the state to open back up for visitation. And, the state rightfully is very concerned about this because in senior care, we deal with really the frailest population. And so they had put restrictions on with the thought that it was only going to be a couple of weeks. Well, a couple of weeks turned into a couple of months and then turned into darn near a half year. And as such, seniors were really suffering and struggling. The lack of connections with families was driving depression up, and it was really a heartbreaking situation. And so they finally said, we've got to do something. And so they have set up new rules, and this just was announced yesterday. And typically, when the state does something like this, there will be some follow ups. Right now, for nursing homes, they are saying that only outdoor visits and no physical contact. In addition, the nursing home must confirm that they've had no positive COVID cases in the last 19 days. They obviously have to have no active cases. And if they do experience an outbreak, they have to be fully recovered with adequate staffing before they can do it. And the facility staff need to be tested weekly. Now, Teresa's house is not a nursing home. We are assisted living and memory care. And because we typically do not take care of as frail of a population, they have allowed us a little bit more leeway. We are also able to do outdoor visits, but we're also able to do indoor visits, but just with plexiglass dividers. Now, they've not yet given us specifics on what those plexiglass dividers need to be like, and so we're all eagerly awaiting that. We also will not be able to have physical contact. And we too have to confirm that we've not had any active cases within the last 14 days, neither in staff or in residents. We have to have adequate staffing to be able to accommodate the visitation. And then, as I mentioned, we do have to have the plexi for inside visits. I'm hearing through other sources that we're going to have to sign attestation statements saying that we've met all of this. The challenge, of course, is that many communities don't have a really good outdoor space. We're fortunate at Teresa's house that we built in big, beautiful porches. So we've got a nice shaded area with good ventilation that folks can visit. Some of the other communities are probably going to have to do some mock-ups of some sort. But I think everybody's going to step up and figure out a way. The key is everybody's going to have to take this very, very seriously, because obviously if this causes an outbreak, they're going to shut everything down again. And so we've got to make sure that everybody takes the precautions. At Teresa's house, we have a significant amount of PPE, so we not only do have our staff wearing KN95 masks, we've got those available for our residents, but when families come, we'll outfit them in K95s. And when everybody has masks on, the safety is just really, really strong. We also have UV lights in our heating and cooling systems. So we've got a lot of extra features that allow us to do this safely. And it's going to be incumbent upon all providers to make sure they do this safely so that we can keep things open because the seniors need to have those visits. So that's the quick update. We're just excited that they're finally allowing visits again.
Yes, that sounds amazing. And I was so excited because I did have a patient that was dying to see his and so excited to see his wife in one of the communities that I'm at. And he was just, I just said, I let him know that like first thing in the morning, and he was just so happy. So I'm glad. So that's really important to be able to see your family. And we've seen the decline, you, myself, Mary. So it's really important to have that kind of bond, and for them to do that is amazing. So that's such good news that you guys have such an amazing, detailed facility or community. It's amazing.
Well, Michelle, we obviously just opened, and 2 of our first 3 residents came from other communities where they didn't have much engagement, and they had really declined during that time. And our model is a high engagement model, and they really rebounded. And as I shared with you, one of the daughters texted me that her mother said that she was happy, and it'd been a long time since she'd been happy, and she started to cry. And that really touched our hearts, but it also really showed us just how problematic this has been for so many. Isolation, whether that's in their homes or in senior care communities. So we're really glad we can do visitations now, but it is important to find a community that does have high engagement, whether that's at home or wherever it is, because seniors need engagement.
Absolutely. Absolutely. Well, thank you, Godwin. I have a question for Mary now. And so what I wanted to ask Mary was, and you can probably chime in after this as well, because it's probably going to be related to both of you. How is your business doing in this pandemic? And have you seen your business coming back? And how are people opening up to resume getting that much needed care? Because I know you and I both, Mary, we've worked together. I've worked together with Cheryl. We go into, say if it's one of the communities and we see a patient that's declining and we've been helping each other. Are you seeing, business coming back?
Yeah, I think certainly people are starting to be more open to having that essential care because they've realized over the course of the last quarter that it truly is essential. We're seeing such devastation from the isolation. You've got the depression, you've got a lack of routine that can create even cognitive decline. You've got an increase in falls. And I think families are starting to see that. Our clients are starting to see that themselves. And you've got to be able to have the opportunity cost of the risk versus the reward of having someone come in and be able to help. So I think that it's definitely something that families are now more open to after they've been on lockdown for many months now, to realize that mom or dad, they need some help, and they need it sooner than later.
The community. So when we're doing happy hours and we're doing, we're in, say the artistry doing blood pressure checks, and they're pretty active. So it's been good to see that, but it's also good to see that if we're seeing that decline, we can call you guys, we can
Mhm.
call an inpatient or outpatient, rehab, or get some outpatient therapy, whatever is going on with that. It's good that we as healthcare providers see those declines so we can all help each other out. Even with me being in healthcare and being in home health and hospice, I will definitely reach out to other entities of home health
Mhm.
or hospice. If there's someone that I can help, or if there's certain situations that arise, I would, I have different entities everywhere, and I hope that everyone has that same motto, because right now we all have to work together. And Monarch has been amazing to Centric, and we love partnering with you and doing whatever we can with you. So I thank you for that, because you guys are the type of people who will call us and let us know that, hey, we need some home health in here, or
Mhm.
hospice. So thank you guys for that.
Absolutely. You guys do a great job, and you guys are truly advocates for the clients and the families, and they need it more now than ever.
Oh, thank you. And so are you. So I love it. And so I know that a lot of people are always needing staffing. I just want to ask you really quick. You guys are doing staffing as well. I just want to make sure that people knew that. Or are you guys hiring?
Yeah, we have done staffing. Yes, we are always looking for, people who are excited and engaged and passionate about the senior population. And yes, we have done a little bit of staffing. Our focus is one-on-one care, but when people need help, they need help, and that's what we're here to do, is to serve.
Oh, well, of course. Nothing but the best. I understand that very well. So I want to ask one quick question to Godwin. Um, with everything that's going on with Teresa's house, we would like to get a quick update from you. And can you let us know what you guys are what we should be expecting in the next couple of weeks with Teresa's house?
Sure. So, for starters, this has been an interesting time to open a senior care, because this is surreal. Never in our careers have we experienced something like this. And it's been a time of joy, and it's been a time of heartbreak, quite frankly. We've had a couple of residents whose families we worked with that we were so excited to have come in, and they developed coronavirus before they came to us. And unfortunately, both declined significantly, and neither one's going to be able to come in. And that's heartbreaking to see folks get affected by this, and actually to see lives get lost. On the flip side, we built our Teresa's house to a healthcare grade. We didn't build it to apartment grade, we built it to healthcare grade, because Teresa and I are career healthcare people. And we'd seen airborne viruses go through buildings before. We'd seen the flu go through a senior care building before. So we built a lot of extra safety features in, and we figured the public wouldn't understand why we did that, why we spent the extra money to make the center so safe. Then a pandemic came along, and all of a sudden everybody appreciated all those extra safety measures. So it's been a blessing that we did put all those extras in, and that we did build a very solid building. The former lead architect for the state of Texas Long-Term Care Regulatory deemed our building the safest in the state. And that wouldn't have even been a discussion point prior to this. So we're feeling very fortunate there. But as far as what's ahead, we open our assisted living on the 17th, and we're really excited about that, because now we've already had memory care open. We can now get assisted living going. And so it's excited to have both and to bring in a whole nother group of seniors. We are able to admit to our first 3, and then once the state finishes their paperwork, we can admit fully. We qualified for a program called Good Standing that is only available to the select few that have the best reputation in the state, that they don't have to go through a health survey. They basically say, we know you, we trust you. Once we've checked off the paperwork, you can admit fully. So we're excited about it because we have a lot of folks eager to get in, and we're close to being able to accept them.
Amazing. Well, I just want to let you know, and let all my viewers know that I've toured Teresa's house. I absolutely adore it. I think it's amazing. It's very detailed oriented. The memory care is amazing. There was no stone unturned and no cut corners anywhere. With the degreed caregivers that you have and the CNAs, I'm jealous. I'm like, I want a job over there, but I will definitely be helping you with any way that I can to get you residents, and I would love to be a part of that. I know that I would love to do a huge event with you, so we can talk about that later, especially with Mary and maybe Joe from Acapella. I hope you would love to be a part of that too, because Grandparents' Day is coming up, and there's nothing I wouldn't do for our grandparents, especially in a time of COVID. So we can announce something, sooner or later. I don't know.
Well, I've got to say, as you know, Michelle, anytime you call, we answer because we think so highly of you, and we're very excited to be working with Centric. And Mary, I love her background, having worked in memory care and skilled, and so I'm looking forward to working with her. And anytime you say the name Joe Alch, everybody gets excited because Acapella has been around for a long time. They have an incredible reputation. In my 17 years running the Presbyterian system, they were my go-to if anybody needed private duty care, and I never had a problem. They always did an exceptional job. So I'm so excited about her Pajamas for Seniors program and look forward to working with you on that. And we look forward to working with so many. There are so many good people in this field. Jeff Suck has come by, Carrie Bartels, Eileen Rains, and I'm going to try to name everybody. I'll forget a bunch of folks, but we've had so many great folks come out, and there are so many people that are really passionate about senior care. Robbie McCullough, Cheryl Akers. Oh, good gosh, the list goes on and on and on of the outstanding people, and we're looking forward to working with each of them and really making a difference for our seniors.
Absolutely, and so have I. So I just wanted to bring Mary on and make sure that everyone know that Mary has a great organization, and she's highly respected right along you with Godwin. So I appreciate you guys so much for being on the show. Is there anything else, Mary, that you would like to share with us? Is there anything that you guys are needing, or is there anything upcoming that you'd like to talk about, or is there anything that I've left out?
Just a reiteration of how great you guys are to work with, and Godwin, I can't wait to see what you've built.
Look forward to having you out.
Yeah, I'll help you set that up. I'll actually come and tour again. I like going there. I like that big country kitchen that you got on there, so everyone could go see them cook. Oh, it's amazing. You guys have to check it out. But thank you guys for both coming on. Yes, and thank you guys both for coming on. We have great guests for next week. Again, I would like to thank Home Care to Go for this opportunity and bringing awareness to our community regarding local healthcare, business, and leadership that the community can trust. Also, you can see recorded conversations of this show on Home Care to Go's Facebook, YouTube, and Periscope pages. You can follow their pages on social media and get notified every Friday when we go live. Thank you guys so much, and make sure you be safe. And also make sure that you wear your mask when needed. Also, just to reiterate, we would love to have you guys on as a speaker. So please contact me or just go to homecaretogo.com/speaker. Again, my name is Michelle Campobasso. I am the Business Development Specialist for Centric Home Health in the Plano branch area. If you need any referrals or if you need anybody to talk to about home health or hospice, I'm your girl. Thank you so much, TJ, for being a part of this project. I love it. Thank you, Home Care to Go, for making this happen, along with all of my guests. You guys have a happy Friday and stay safe. Stay safe.